Okay, hi everyone. You're all welcome, and let me introduce myself. My name is Selin Taşlıoğlu. The topic of today's meeting is gastrointestinal system. And first of all, I would like to outline the presentation. At the beginning, we will watch a video about the topic, and then I will present the presentation with questions. Finally, we will game of Kahoot. Now I will share my screen. Okay.
The digestive system is composed of two main components: the gastrointestinal tract or GI tract, where digestion and absorption take place, and accessory organs, which secrete various fluids and enzymes to help with digestion. The GI tract is a continuous chain of organs where food enters at one end and waste gets out from the other. These organs are lined with smooth muscles whose rhythmic contractions generate waves of movement along their walls, known as peristalsis. Peristalsis is the force that propels food down the tract. Digestion is the process of breaking down food into smaller, simpler components so they can be absorbed by the body. Basically, carbohydrates such as sugars and starch are broken down into glucose, proteins into amino acids, and fat molecules into fatty acids and glycerol. Digestion starts in the oral cavity, where the food is moistened with saliva and chewed. Food bolus is formed to facilitate swallowing. Saliva is secreted by the salivary glands and contains the enzyme amylase. Amylase breaks down starch into maltose and dextrin, which are processed further in the small intestine. The food bolus is propelled down the esophagus into the stomach, the major organ of the GI tract. The stomach produces gastric juice containing pepsin, a protease, and hydrochloric acid, which act to digest proteins. At the same time, mechanical churning is performed by muscular contraction of the stomach wall. The result is the formation of chyme, a semi-liquid mass of partially digested food. Chyme is stored in the stomach and is slowly released into the first part of the small intestine, the duodenum. The duodenum receives the following digestive enzymes from accessory organs: bile, produced in the liver and stored in the gallbladder. Bile emulsifies fats and makes it easier for lipases to break them down. Pancreatic juice from the pancreas. This mixture contains proteases, lipases, and amylase and plays a major role in digestion of proteins and fats. The small intestine also produces its own enzymes: peptidases, sucrase, lactase, and maltase. Intestinal enzymes contribute mainly to the hydrolysis of polysaccharides. The small intestine is where most of digestion and absorption take place. The walls of the small intestine absorb the digested nutrients into the bloodstream, which in turn delivers them to the rest of the body. In the small intestine, the chyme moves more slowly, allowing time for thorough digestion and absorption. This is made possible by segmentation contractions of the circular muscles in the intestinal walls. Segmentation contractions move chyme in both directions. This allows a better mixing with digestive juices and a longer contact time with the intestinal walls. The large intestine converts digested leftover into feces. It absorbs water and any remaining nutrients. The bacteria of the colon, known as gut flora, can break down substances in the chyme that are not digestible by the human digestive system. Bacterial fermentation produces various vitamins that are absorbed through the walls of the colon. The semi-solid fecal matter is then stored in the rectum until it can be pushed out from the body during a bowel movement.
Okay, the video is ended. And now my presentation. Okay, gastrointestinal nursing questions. Introduction to the gastrointestinal system. The gastrointestinal tract consists of a hollow muscular tube starting from the oral cavity, where food enters the mouth, continuing through the pharynx, esophagus, stomach, and intestines to the rectum and anus, where food is expelled. There are various accessory organs that assist the tract by secreting enzymes to help break down food into its component nutrients. Thus, the salivary glands, liver, pancreas, and gallbladder have important functions in the digestive system. Food is propelled along the length of the gastrointestinal tract by peristaltic movements of the muscular walls. The primary purposes of the gastrointestinal
slide. We can't see.
I'm sorry, I don't understand, Dennis.
We can't see your PowerPoint now, your screen.
Oh, okay.
Can you try again, please?
Okay. I forgot my screen. Yeah, and now?
Yes, okay. Thank you.
Okay. Thank you, Dennis. Yeah, gastrointestinal nursing questions again. Introduction to the gastrointestinal system. The gastrointestinal tract consists of a hollow muscular tube starting from the oral cavity, okay, where food enters the mouth, continuing through the pharynx, esophagus, stomach, and intestines to the rectum and anus, where food is expelled. There are various accessory organs that assist the tract by secreting enzymes to help break down food into its component nutrients. Thus, the salivary glands, liver, pancreas, and gallbladder have important functions in the digestive system. Food is propelled along the length of the gastrointestinal tract by peristaltic movements of the muscular walls. The primary purpose of the gastrointestinal tract is to break food down into nutrients which can be absorbed into the body to provide energy. First, food must be ingested into the mouth to be mechanically processed and moistened. Secondly, digestion occurs mainly in the stomach and small intestine, where proteins, fats, and carbohydrates are chemically broken down into their basic building blocks. Smaller molecules are then absorbed across the epithelium of the small intestine and subsequently enter the circulation. The large intestine plays a key role in reabsorbing excess water. Finally, undigested material and secreted waste products are extracted from the body via defecation. Okay. And I was starting with questions. The first question, dark cherry stools indicate bleeding in which location of the gastrointestinal tract? Upper colon, lower colon, upper gastrointestinal tract, small intestine. The answer is C. Melena is the passage of dark, hairy stools that contain a large amount of digested fluid. It occurs with bleeding from the upper gastrointestinal tract. And there is some definition about upper gastrointestinal tract. You can see. Okay. The second question, the nurse is providing discharge instruction to a male client following gastrectomy and instructs the client to take which measure to assist in preventing dumping syndrome. Ambulate following a meal, eat high carbohydrate foods, limit the fluid taken with meal, sit in a high focus position during meals. The answer is C. Dumping syndrome is a term that refers to a constellation of vasomotor symptoms that occurs after eating, especially following a Billroth 2 procedure. Early manifestations usually occur within 30 minutes of eating and include vertigo, tachycardia, syncope, sweating, pallor, palpitations, and a desire to lie down. The nurse should instruct the client to decrease the amount of fluid taken at meals and to avoid high carbohydrate foods, including fluids such as fruit nectars. To assume a low focus position during meals, to lie down for 30 minutes after eating to delay gastric emptying, and to take antispasmodics as prescribed. The first question. A male client with a peptic ulcer is scheduled for a vagotomy, and the client asks the nurse about the purpose of this procedure. Which response by the nurse best describes the purpose of a vagotomy? Halts stress reactions, heals the gastric mucosa, reduces stimulus to acid secretions, decreases food absorption in the stomach. The answer is C. A vagotomy or cutting of the vagus nerve is done to eliminate parasympathetic stimulation of gastric secretion. Options A, B, and D are incorrect descriptions of a vagotomy. The third question. A nurse is preparing to care for a female client with esophageal varices who has a Nclex molar tube inserted. The nurse gathers supplies, knowing that which of the following items must be kept at the bedside at all times: an obturator, cali clamp, an irrigation set, a pair of scissors. The answer is D. When the client has a Nclex molar tube, a pair of scissors must be kept at the client's bedside at all times. The client needs to be observed for sudden respiratory distress, which occurs if the gastric balloon ruptures and the entire tube moves upward. If this occurs, the nurse immediately cuts all balloon lumens and removes the tube. An obturator and a cali clamp are kept at the bedside of a client with a tracheostomy. An irrigation set may be kept at the bedside, but it's not the priority item. The fifth question. Nurse Oliver checks for residue before administering a bolus tube feeding to a client with a nasogastric tube and obtains a residual amount of 150 milliliters. What is appropriate action for the nurse to take? Halt the feeding, range still the amount and continue with administering the feeding. Elevate the client's head at least 45 degrees and administer the feeding. Discard the residual amount and proceed with administering the feeding. The answer is A. Unless specifically indicated, residual amounts more than 100 milliliters require holding the feeding. The four options B, C, and D are incorrect. Additionally, the feeding is not discarded unless its contents are abnormal in color or characteristics. The sixth question. What information is correct about stomach cancer? Stomach pain is often a late symptom. Surgery is often a successful treatment. Chemotherapy and radiation are often successful treatments. The patient can survive for an extended time with TPN. The answer is A. Stomach pain is often a late sign of stomach cancer. Outcomes are particularly poor when the cancer reaches that point. Surgery, chemotherapy, and radiation have minimal positive effects. TPN may enhance the growth of the cancer. The seventh question. The nurses on a unit are planning for stomach care for clients who have a stomach for facial diversion. Which stomal diversion poses the highest risk for skin breakdown? Ileostomy, ileal conduit, transverse colostomy, sigmoid colostomy. The answer is A. Ileostomy output contains gastric and enzymatic agents that, when present on skin, can denude skin in several hours. Because of the caustic nature of the stoma output, adequate peristoma skin protection must be delivered to prevent skin breakdown. The 8th question. You're preparing a patient with a malignant tumor for colorectal surgery and subsequent colostomy. The patient tells you he's anxious. What should your initial step be in working with this patient? Determine what the patient already knows about colostomies. Show the patient some pictures of colostomies. Arrange for someone who has a colostomy to visit the patient. Provide the patient with written material about colostomy care. The answer is A. Initially, you should assess the patient's knowledge about colostomies and how it will affect his lifestyle. The 9th question. Before bowel surgery, Lee is to administer NMS until clear. During administration, he complains of intestinal cramps. What do you do next? Discontinue the procedure, lower the height of the enema container, complete the procedure as quickly as possible, continue administration of the enema as ordered without making any adjustments. The answer is B. Lowering the height decreases the amount of flow, allowing him to tolerate more fluid. The 10th question. Janice is waiting for discharge instructions after her herniorrhaphy. Which of the following instructions do you include? Eat a low-fiber diet, resume heavy lifting in 2 weeks, lose weight if obese, resume sexual activity once discomfort is gone. The answer is C. Because obesity weakens the abdominal muscles, advise weight loss for the patient who has had a hernia repair. The 11th question. The nurse is monitoring a female client with a diagnosis of peptic ulcer. Which assessment findings will most likely indicate perforation of the ulcer? Bradycardia, numbness in the flanks, nausea and vomiting, a rigid board-like abdomen. The answer is D. Perforation of an ulcer is a surgical emergency and is characterized by sudden, sharp, intolerable severe pain beginning in the mid-epigastric area and spreading over the abdomen, which becomes rigid and board-like. Nausea and vomiting may occur. Tachycardia may occur as hypovolemic shock develops. Numbness in the legs is not an associated finding. The 12th question. A nurse is preparing to remove a nasogastric tube from a female client. The nurse should instruct the client to do which of the following just before the nurse removes the tube? Exhale, inhale and exhale quickly, take and hold a deep breath, perform a Valsalva maneuver. The answer is C. When the nurse removes a nasogastric tube, the client is instructed to take and hold a deep breath. This will close the epiglottis. This allows for easy withdrawal through the esophagus into the nose. The nurse removes the tube with unsmooth, continuous pull. The 13th question. You're doing preparative teaching with Gertrude, who has ulcerative colitis, who needs surgery to create an ileoanal reservoir. Which information do you include? A reservoir is created that exits through the abdominal wall. A second surgery is required 12 months after the first surgery. A permanent ileostomy is created. The surgery occurs in 2 stages. The answer is D. An ileoanal reservoir is created in 2 stages. The 2 surgeries are about 2 to 3 months apart. First diseases, intestines are removed and a temporary loop ileostomy is created. Second, the loop ileostomy is closed and stool goes to the reservoir and out through the anus. The 14th question. What is the name for the system of coordinated peristaltic waves that slowly sweeps food through the small intestine for digestion? Segmentation contractions, mass movements, the migrating motor complex, none of these. The answer is C. The system of coordinated peristaltic waves that slowly sweeps through the small intestine for digesting is called the migrating motor complex. Disorderly motion of this complex can result in a wide variety of gastrointestinal complaints such as vomiting, dumping syndrome, bloating, or indigestion. Segmentation contractions mix the contents of the colon for more absorption, while mass movements serve to propel feces towards the rectum. And 15th question and last question. Which of the following will the nurse include in the care plan for a client hospitalized with viral hepatitis? Increase fluid intake to 3,000 milliliters per day, adequate bed rest, blend diet, administer antibiotics as ordered. So the answer is B. Treatment of hepatitis consists of bed rest during the acute phase. The reduced metabolic demands on the liver, thus increasing blood supply and cell regeneration. Options A, C, and D for symphylates, antibiotics, and blend diets are not part of the treatment plan for viral hepatitis. Okay, my presentation is done. Thank you for listening and thank you for your attention. Now we can move on the game. Okay, it's opening slowly. Okay. You can join the game. It can be enjoyable for you and me. Yeah, the code is coming. Okay, I'm waiting for you. Okay, 7%. I can wait a little minute.
We are ready.
Okay, we will start. Yeah. What hormone stimulates a feeling of hunger? leptin, ghrelin, cholecystokinin, gastrin. Yeah, the true answer is ghrelin, but okay, no problem. The second question, what is the name of the muscular ring that separates the small intestine from the large intestine? Cardiac sphincter, pyloric sphincter, ileocecal sphincter, well, lower esophagus sphincter. Yeah, the true answer is ileocecal sphincter. Okay. The third question. All of the following are main functions of the large intestine except absorb water, digest food, store fats, absorb electrolytes. Yeah, the true answer is digest food. The other question is, the duodenum wraps around what digestive organ? The pancreas, the stomach, the liver, the gallbladder. Yeah, the true answer is the pancreas. Okay. What nerve innervates the external anal sphincter? The pudendal nerve, ileocecal nerve, clunal nerve, and perineal nerve. Yeah, the true answer is the pudendal nerve. Okay. What vein carries the nutrient-rich blood from the gastrointestinal system to the liver for processing? The ileal vein, the splenic vein, the hepatic portal vein, the left gastric vein. Okay, the true answer is the hepatic portal vein. Yeah. What is the function of gastrin in the digestive tract? Increases gallbladder emptying, triggers sheath shells that secrete pepsinogen. All of these are true. Triggers parietal cells that release, yeah, H. cili. The true answer is all of these are true. Okay. The portions of the small intestine in order from superior to inferior are duodenum, jejunum, ileum, jejunum, cecum, duodenum, duodenum, ileum, jejunum, ileum, jejunum, cecum. Yeah, the answers are repeating. Okay, true answer is A. Okay. Which of the following isn't a complication of peptic ulcer disease? Perforation, gastrointestinal bleeding, pyloric obstruction, and pain. Okay, the true answer is pain. Okay. The last question. Ralph has a history of alcohol abuse and has acute pancreatitis. Which lab value is most likely to be elevated? Calcium, glucose, magnesium, potassium. Yeah, the true answer is glucose. And the game is ended. Okay, congratulations, Zeynep. Congratulations, Dennis. And congratulations, Cardinal. Okay. And congratulations, Melissa and Hakan, of course. Okay, thank you for joining. Yeah. And thanks, everyone. Again, thanks for listening and thanks for your attention. It is good for me and for you, I hope. And next week, have a nice day. See you soon.
Thank you.
You're welcome, Dennis. You're welcome, Miss.